Hello everyone, sorry I'm running late, but I got distracted by the kittens when I was setting up. As you can see, there's my kittens on the stream here, on the picture here, and I've got a little video to show you. And seeing as I've actually not planned anything, I thought I'd just go through a few of the things that I'm doing at work at the moment and saying how crazy things are at work. Hi, hi Ray, great to have you on. I don't know whether Sam and Cal are back around or not. I know they've already said hi in the stream. I don't know whether they've. Oh, hi Amanda. Yeah, hi Cal. Oh, they are so cute. They are so tiny. So yes, so they were 8 weeks old on Saturday. We went and picked them up yesterday, and yeah, they've just been hiding in my daughter's bedroom. She's got it set up with a little tray, their food, their bed, and everything. They're in there. So my other two cats, Minnow and Nobby, have the rest of the house. They have looked at each other a bit across sort of the doorways and entrances. They did try pounce. The kids tried pouncing towards Nobby, and he did hiss at them, and he ran away. But at the moment, I've just got distracted because I went in my daughter's bedroom, and they both have managed to jump up onto the windowsill, looking out into the garden, and Minnow's in the garden looking back in the windowsill. So very, very cute. Right. Yeah, I'm just checking that. Yeah, they are cute. So, so Ray, your university work. Oh, yeah. Once you're back at studying, you have to try and fit it in all the time. And Cal, you're cleaning. Yeah, well, I've just been cleaning. I've had a load of washing on. I've been to the gym this afternoon. I'm actually doing quite well at the gym. So I'm going swimming 3 times a week now, and I'm getting anywhere between 40 and 64 lengths, depending on whether it's the hour session or the 2 hour session, and whether I get talking to other people while I'm there. And then when I go to the gym, I go on either the recline cycle, the normal cycle, or the rower for 5 or 10 minutes. And then the 6 machines that I use, 3 for my arms, 2 for my legs, and 1 that sort of crunches your abs. They're all easy, all really easy to use. They just work on resistance bands, and you just change the push the numbers in to change the resistant bands. But I think I'm now at the stage where I might actually learn how to use the big proper gym. So I'm going to book in to see the personal trainer down there and get her to show me some new machines and some new things to do. Hi, make me smile. Yes, so these are our brand new kittens. They were 8 weeks old on Saturday, and we went to pick them up off their mummy. So yeah, so they're our babies. They're so cute. So yeah, how is everybody doing? So yeah, hi Sam, hi Cal. Yeah, how are you doing, Sam? Are you feeling any better? I know you've had several health issues recently. And yeah, how is everybody? Has anybody got any medicines questions, supplement questions? And then I was just going to tell you what I'm going on with at work, but I am going to show you a very cute video of the kittens playing. So the one that's busy chasing the mouse is Poppy, and the one that's just hiding and looking is Periwinkle. Periwinkle has a little cheeky meow and is very cute. Poppy doesn't seem to. Poppy, I think, is the one that was actually born the day earlier, on the Friday. But yeah, they're both very cute. They play together. They curl up together. They clean each other. And yeah, they're very bonded. Obviously, they have been separated from mum and their other two siblings. But yeah, they are so crazy. So 1:30 this morning, my daughter shouted me through, going, "They're being crazy. They want to go to sleep," but they did eventually. But yeah, like with human babies, they sort of need a lot of sleep and a lot of play. They just do it at random times. Right, just maybe change the layout. Yeah, I'll keep them in the background so you can see me, but you can keep them loose there. Right, okay. Aspartame, is it banned in Europe? No, it isn't. And yes, I think there was the change in aspartame instructions on the fact that I think it was the World Health Organization put it into the category of potentially carcinogenic, but it actually needs to be taken with a bit of nuance when you actually read into it. They're taking that on studies where extremely large doses of it were given to rats and mice, and in extremely large dosages, like with anything in extremely large dosages, there is a point at which it can become a poison and can become carcinogenic. But I think you'd literally have to be, I think they did a calculation, and literally you'd have to be drinking sort of 50, 60 cans of aspartame containing drinks every single day for the rest of your life for it to slightly increase your risk of cancer. So it's not, yeah, as with everything, and everything in overdose will become a poison. But in normal doses that you're going to have in normal everyday exposure. So if you're having just 1 or 2 cans of aspartame containing drinks a day, it's not going to be at a limit where it actually causes any problems. Again, with aspartame and the other sweeteners, there was a link trying to say that artificial sweeteners caused insulin spikes and changes to your gut microbiome. And whereas there might be a little bit of evidence that they change your gut microbiome, it doesn't cause insulin spikes. And it's all about sort of nuance and moderation. If you've got the choice of drinking sort of just hydrating plain water, or water with a little bit of sort of fruit juice flavoring, then obviously that is going to be the healthiest option. But if you're comparing a diet soda that's got aspartame or the other one or the other sweeteners compared to your full sugar ones, having that much reduced amount of calories is going to make sure that you're not spiking your blood sugar levels and your insulin levels, and is going to make sure that you're not gaining extra calories and that extra weight. So it's all about balance. Yep, if you like water, you can get on with water, and you don't mind drinking water, then brilliant. But if you require that extra taste to help you drink the required amount of hydration a day, it's not the worst thing. And obviously then your calories and how much sugar containing drinks is as long as you're within your sort of calories for the day. Yeah. So this is my emotional support water bottle. I got it as a Secret Santa from work. I have worked out who at work got me it. They obviously realised that I love Stitch because I've got let's see if I can get my arm out on here, because I've got my little Stitch and Toothless tattoos on here. So they got me this, and I use it all the time. It really helps me keep hydrated. So I do have my Pepsi Max in the morning, or my cup of tea in the morning, and then after lunchtime I start on these, and I drink 2 or 3 of these in an afternoon. I also use it when I go to the gym. If I'm going to the gym, I do put pre-workout in there. And then I use it for going swimming. And when I'm swimming, I use it to help me track how many lengths I've done. So there's the tiles along the edge of the pool where we put our water bottles. And every time I do 10, I move it along. I move my water bottle along one tile so I can track where I'm going. One of the other ladies who's there, every time she does 6, she moves her water bottle along half tile. So we race our water bottles along the side. So, I use it quite a lot. Keeps me sorted. Okay, so hi, Mr. Angel Lab. Hope you've caught and seen the cats. Oh, yeah, so Make Me Smile says, our cats woke us up this morning because they wanted treats. Yeah, any excuse. Minnow, who is she was our crazy kitten, even though she's now 4 years old, and we still probably call her a crazy kitten, although she now feels massive compared to the little ones. She will wake us up randomly for treats, whereas Nobby, our eldest, who's 10, he wakes us up for proper food. So yeah. So I think that's what somebody else had asked an actual question further up. Let me go. Right. So Cal says, I don't use light products because most sugar replacements give me migraines. And that's a very good point. Migraines can get triggered by so many different things. So sugar levels can actually trigger migraines, massive increases and decreases in sugar levels. Hydration and water levels can trigger migraine. So if you get dehydrated, that can trigger a migraine. Caffeine, which is obviously in a lot of soft drinks and in your hot drinks, can trigger migraines. And not just having caffeine, lack of caffeine can actually trigger migraines as well. And then, some of the artificial sweeteners and things can trigger migraines, as can some of the food colorings and such like. So once you suffer from migraines, working out your triggers is one of the main sort of therapies for treating migraines, is to find out your triggers and avoid them. Like when you've got food intolerances, finding out what are your triggers is the most important thing. Okay, Sam says, not too bad, but my brain is refusing to brain today. Oh, yeah, I know that feeling. And and sort of Cal says, brain fog from hell. So I quite often, if I have a migraine, then I have my post-migraine fog day the next day, where you just, going through treacle. Right, there Cal had asked the question. Cal says, what I'm wondering is if you're going to be talking about the risks of taking multiple supplements together. I possibly can put a full video together, but yes, like taking multiple medicines together, multiple supplements together can be problematic. The main problem with multiple supplements is ensuring that you're not duplicating any of the ingredients. So many supplements actually have multiple ingredients in there, and they'll add in sort of extras. The common one is they'll always add in vitamin B6 for some random reason. So you really have to check the labels when you're taking supplements, to check all the ingredients and check you're not sort of doubling up or tripling or quadrupling up on different vitamins and minerals. Because as I've said, even if something is a healthy product or an essential vitamin, at a certain dosage, your body can't excrete all of it, and the dose can make the poison, and they can become problematic. Plus, then if you're taking multiple supplements for the same sort of thing, so if you were to take supplements to give you energy and you're taking multiple of them, you've got the risk of the added side effects. If you've got things, all the nootropics, sort of the caffeine, and all of those sort of things that increase your energy, you then get increased risk of arrhythmias and such like. Also, if you're taking ones that are sort of more relaxing, and sleepy, then you can enhance drowsiness and sleep effects. So like with medicines, and also then taking multiple supplements alongside having multiple medications, you also need to check for interactions. So I would always check with a pharmacist if there is interactions with any supplements and medicines that you're taking. Let me go. Like IBS, migraines about limiting triggers because curing isn't an option and it can be frustrating. Absolutely true, Cal. And there is a big link between IBS and migraines. There is some thinking that some people with IBS, it is actually a intestine migraine, so a gastro migraine, because obviously with migraines, you don't always have a headache. It's not just a headache, it is a whole system disorder, and nausea, vomiting, stomach cramps, diarrhea can all come with the migraine, as is the same symptoms as an IBS, and a lot of them can be the same triggers. So foods that can trigger the migraine also trigger the IBS. So there is a link. A lot of people have a crossover, have both migraines and IBS, and it may be the same. Sam says, how long does the tiredness last after a stroke? Not my area of expertise. I don't really do much with stroke rehab, just sort of the medication post-stroke. So I would say you would be best talking to the specialist nurse if you've got access to from the stroke unit, who'd be able to say. But everybody's recovery after a stroke can be different, especially depending on how big a stroke, what part of the brain was damaged, how much of the brain was damaged. But I would say you need to be taking it steady, building back up, tracking how you're doing, and then going through that with your doctor, with your nurse, with the rehabilitation, and seeing how it goes. You may not ever get back to the same level as you was before. Some people do, but it depends on which part of the brain was damaged. Okay, Make Me Smile said, I already take a multivitamin and the podiatrist wants me to take more of the vitamin D and calcium, but you're afraid to do so. Right, I have done a video previously on can you overdose on calcium and vitamin D? So it might put your mind at rest if you go and actually watch that video. On the vitamin D, pretty much you can't overdose. For somebody to overdose, they would literally be needing to take the treatment dose that's given weekly, daily for several weeks on end to actually get to a point where you would actually be overdosing on vitamin D. It's very unlikely. The majority of people are always deficient in vitamin D and needing extra. However, with calcium, you do need to be a bit more careful because increasing calcium levels in your blood can be problematic. But that's usually mostly if you're not taking the vitamin D alongside it, because it's the vitamin D that ensures that the calcium is going into your bones and being processed correctly. So go back and have a look at the video that I have made on can you overdose on calcium and vitamin D. I've got in there some of the actual recommended daily allowances, but obviously for yourself, double check that with your own pharmacist for your recommended daily amounts. But I'll put your mind at risk. You're very unlikely to overdose on vitamin D and calcium. You'd have to be taking the sort of replacement dose incorrectly, as in the one that they give you to take weekly, you'd have to be taking daily. But yeah, it is one of the most important vitamins out of all the supplements. The most common supplement that I would say most people need is vitamin D. Not so much the calcium. Most people can actually get significant enough calcium in the diet. What they're lacking is the vitamin D to process that calcium into their bones. So, hi Lisa, it's fine. We've only been talking random, showing my kittens. There is a video of my kittens playing back at the beginning if you wanted to go back. Cal says, I do sometimes have intense migraines that cause throwing up, but I never knew they could be linked. Might need to discuss that with your gastro. Yes, definitely mention to your gastro specialist that you have migraines, and they may be able to sort of say whether they think what your current gastro problems are, whether they're linked to your migraines or they're a separate issue. But it's always worth mentioning the other areas. Sometimes we can get very much with specialists, they just concentrate on their area, whereas sometimes things are very much interlinked. We're a full body syndrome. Yeah, you're welcome. Make me smile. Yeah, that's what I'm here for. Ask you questions. So I just thought I might sort of just do a quick update. I'm not going to be long. I have got to get back to the kittens. We are going to be watching the football later. So for those of you that may not be from England, the England football team have got through to the finals of the Euros. So we're playing Spain later on. So I will be watching that. That's soccer to any of you Americans, but it's proper football to us English. So... but yeah, so we'll be watching that. So I won't be going on too long. And obviously I have been to the gym and that today. But yeah, so hopefully it'll be a good match. All I'm hoping for is that we either win or lose in the 90 minutes, because I can't stand the stress of extra time and penalties. Pardon? Oh, we've got to escape your kitten. Come here. Come on. Oh. We've got a little escapee. This is Poppy. Yes, you. Trying to escape out your mummy's bedroom. Yeah. Yeah. Meow. Yeah. You have no idea what a computer is, do you? Yes. Let me go give you back to your mummy. Go on. Take them both back in there. Let me escape. Oh. That's them both back. Yes, I'm guessing that they are going to be problematic. Yeah. Okay, so Cal says your company has the football watch parties. Yeah, I think everybody will be watching today. Sam says, I've recently noticed I can't eat cheap bread, only sourdoughs for some reason. That's probably, sourdough is usually made literally just from the flour and the sourdough starter. So there's really not much in it other than just pure flour. Whereas cheap bread, you'll have loads of different sort of preservatives and such like added in there. So there's probably some additive that they add in there that you might be slightly intolerant to. Yes, Poppy the escape artist. Yeah. So, yeah, so I was just... Oh, Cal says, are there any new pharmaceutical breakthroughs in the treatment of bipolar disorder? Not that I know of. I know there are some newer antipsychotics out there. I know they have trialed different of the anti-epileptics out there, but not that I know of, although that's not my area, that I don't tend to keep up to date with sort of what the new guidelines are and the new treatments are for that. That's usually one of my colleagues. He does a lot of looking into that. I know he was talking about another antipsychotic that we're trying to ask the GPs to do the prescribing of. We really do need some more research into the the treatment of mental health, because a lot of the mental health medications that we have, they still don't actually know how they work. They still don't actually know how the brain works. They know that there's links to your dopamine, your acetylcholine, your noradrenaline and your serotonin receptors, and the drugs all alter them. But yeah, they don't particularly know exactly how they use, how they alter. I remember once I did do a month stint at the mental health hospital. I even did a week stint at the mental health prison as well, sort of during my training. And they do lots to sort of track a patient's mental health alongside which medication they're on, to sort of see which one works best. But they're very much patient dependent for mental health medication. What works for one set of patients doesn't work for another set of patients. So yeah, the brain is extremely complex. The amount of neurons and connections and how it works is not fully understood at all. And it's not something, although I know some of how the medications work in the brain, it's very, very complex. Which is, we have had, one of the things that we're working on at the moment is, so sodium valproate is an anti-epileptic medication that has been used for decades, known as Epilim. It's been used for epilepsy for decades, and also been used to treat bipolar as well. And it's been realised that there's a link to it being teratogenic, to it actually causing significant birth defects and mental health disorders in the babies. And although there's always been the warnings not to use it in pregnancy, and that's the warnings have always been there. It's always been told for people to not get pregnant. There has been accidental pregnancies over the years, and we have now got these children that were treated where their parents were treated with it, and they are now showing the effects and are now becoming adults. And they've now actually determined that this is such a major issue that everybody who is being treated with sodium valproate and is of childbearing potential must have definite pregnancy prevention procedures put in place. So not just please don't get pregnant, but you are not to get pregnant on this. You need to have a definite form of contraception or double contraception. So literally like making sure that they've got the implant in so that they definitely can't get pregnant. So when that needs to be done again every 12 months. So we're putting a lot of things in place to ensure that all patients on sodium valproate are having this. It has now been rolled out that any new patients being started on it need to be seen by 2 consultants. They've even now put that in for men that can potentially be father children, because there's the link there as well. And since then, we've had more recently another anti-epileptic, which is also used to treat migraine. I talked about it in my migraine live stream, topiramate. It's also been shown to cause significant issues for the babies in pregnancy, and they're now putting in plans to ensure that everybody who is on topiramate has a pregnancy prevention plan in place, and to review all patients that are on it to make sure that that is. So that's one of the jobs that I do in my role, because I work for the Integrated Care Board of the NHS, is to actually make sure that there's the policies and procedures and the actual practicalities put in place. So all the GP practices have a list of all their patients on the medication, and that they have all had they've all been sent to see the consultant within the last 12 months, and that this pregnancy prevention protocol has gone through, signed off by the consultant, by the GP, by the patient. So it's all in place. And then that's repeated every 12 months. And it is a lot of work to actually get the practicalities done. It's okay them saying sort of nationally there needs to be these safety profiles, but getting down to making sure it's done at a patient level can be quite tricky. So I'm just going to go. Kat says, oh, welcome, Kat. I don't think I've already said hello to you. So the side effects of anything that seem like it might work are so horrible, but it's also pretty horrible to try and be unmedicated. Yeah. And that's always the thing with any condition and any treatment, is to do a risk benefit analysis. So what are the benefits? How much is it going to improve the condition or prevent flares, relapses, compared to how much side effects is a treatment or a medication going to cause? And that can be totally different for individuals, although we might have the trials that say sort of it's worked well, reduced symptoms by 50% in 50% of people, and that the side effects may only affect 10% of people. It does actually need taking and reviewing when an individual actually starts the medication, having a review at sort of after a few weeks, after a few months, how much of the benefit are you having and how much of the side effects are you having. And Cal said, even the parts we did think we understood, like the gut, turn out to be very wrong too. We just find out more and more, and how much we don't know from, yeah. That's the thing with science. We're always learning. We put a theory together, we observe, we find out what's happened, we make some sort of theories from our observations, then we need to test it out, then we need to observe again on larger amount of people, and yeah, just keep backing up with more and more evidence. And then yes, as we get new treatments coming along, we need to trial them out and see whether they're better or worse. So quite often when a new drug in a new therapeutic area comes on the market, it has to show that it is works for that therapeutic area and provides some benefit. But when future drugs come along in a therapeutic area where there's already established medication, then they have to do what we call non-inferior trials to prove that they're as effective as medication that's already on the market, so that there's no point going, oh yes, and we've now fetched onto the market a new agent, but it's not as good as the previous one. Every new one has to show non-inferiority to what's already on the market, and then also show that they've got reduced side effects. We always need to be progressing and increasing. So, oh dear, your keyboard stopped working. Yeah. Now I'm just trying to think of another one of the things that we've been doing in the last few weeks at work is, as I was talking about with migraines, there's a new set of medication called the Gepants. So there's Gepant that's now on the market, and NICE Guidance in the UK have approved it for use for treating acute migraine. So you can take one with an acute migraine, and it works along similar lines to the triptans, but it works slightly earlier in the pathway, and it doesn't cause overuse headaches if you take too many of them. But yeah, you should only need up to 8 a month, because you can only take one every 48 hours. And then it can also be used as a preventative in people that have already tried 2 or 3 other preventative medications. It can be added in. So we've been discussing, so NICE have approved it for use for the treatment of acute migraine and for the prevention of migraine. And we're now trying to work out practicalities, how we actually get that prescribed to the patients in line with the current guidelines. So at the moment, we've got guidelines that what a GP will follow with what they treat an acute migraine with. So the paracetamol, maybe sort of ibuprofen, naproxen, maybe going on to the triptans. And then if somebody's having sort of more than 4 or 5 a month, they might then start them on the prophylactic. So we talked about sort of the beta blockers, the topiramate, which may not be being used now that we've got to check on pregnancy prevention, and maybe ACE inhibitors and a few other things, amitriptyline. But where are we going to add in this new agent? So we discussed it, and the GPs that were on the forum where we discussed it were very nervous about starting a new medication where we don't know the long-term effects. So they wanted some more education. So we're putting a plan together to provide some education out to our GPs and our nurses out in primary care so that they can start it, so that they're not having to refer everybody to a neurologist to get access to it. So that's one of our my jobs is making sure that sort of the guidelines that get put out nationally, we find a way of getting that information to GPs and nurses actually working in every GP practice, so that they have the confidence to know how to use these new agents and where to use them compared to the older agents. So that's one of the meetings that I was in. One of the things I'm looking forward to this week is we are planning to do what we call a swap shop for patients for their blood glucose testing strips. So there's been new national guidance on which are the most appropriate blood glucose testing strips to use that are cost effective and reach international standards. So we've got a new formulary of the most appropriate devices. So we're going to we've sent out text messages and letters to invite all the patients in that are on the older versions of the blood glucose testing strips, inviting them in for the afternoon, where they can come in. We can show them all the new meters that are actually up to standard for them, let them have a look, let them decide which one they want, whether they want one similar to that old machine or whether they want to try a new type that might have more functionality. So, yeah, so they can have a look. And what we quite often do is they don't just come in, because it's pharmacists and technicians that are doing this. We chat to them about everything. So if they start saying that, oh, well, I'm testing 6 or 7 times a day, we might actually go, well, why are you testing 6 and 7 times a day? Is that needed? What are your sugar levels like? Do you need to have your medication reviewed to be on a different regime to either improve your sugar levels? Are you needing to go on one of the devices that continually measures your blood sugars, so that you don't actually have to test your fingertips as often and save them fingertips, because it really does hurt. Those the fingertip testing needles, your fingertips are so sensitive, they really do hurt. So at the last swap shop we did, we ended up out of I think we had about 60 patients come through in the afternoon, and I think about 6 of them we referred through to the specialist nurse to actually go on to the to actually have the continuous blood glucose device going forward, not just changing their meter. And there was quite a few where we discussed their sugar levels, one where she just couldn't get her morning sugar levels correctly. So we went through some reasons why that was. Another person who had been on their GLP-1, lost some weight, and their sugar levels were now in range. So it was just talking about which medication we could potentially take them off now that they actually got their blood sugars into range. So it was great being able to do those reviews. So yeah, Ray, I would love to be able to get some more sensible, nuanced advice out to people, like Chantel, you know, to help with the compliance to the medication, understand why they need to take them consistently. It's not just a take it when you fancy or take it when you think you've had a big meal and you think your sugars are high, but actually to be able to consistently check your sugars, consistently take your medication when you should be. Hello, Salman. Anything within reason around sort of medication supplements? Obviously, I haven't run my disclaimers. I better run them in a second. Obviously, I can't provide personal medical advice, but I can provide general information about medication and supplements. Right, that reminds me, I better run my disclaimers. So obviously this is for information for educational and entertainment purposes only. Contact your own healthcare professional for individual advice. Obviously, I do try and keep up to date with all the clinical evidence that's out there and guidelines, but obviously I am UK based, so it's the medicines and supplements that are available in the UK that I know the most about. And obviously there is differences across the world, especially things like what they're called. So paracetamol in the UK is called acetaminophen in the US. I'll also do the quick plug for like, subscribe and comment. I'll just do that. I had to actually update that to have the newer background on it, still on the older background. So yeah, so I am quite excited about doing that swap shop again, because yeah, I love just being able to talk to the patients and yeah, help them with what they're currently taking and getting them sort of understanding the medication, because if you understand your medication and why you're taking each one, you're more likely to remember to take it and want to take it. And also if you have an idea of what potential side effects are, you're able to work out whether things that you're suffering from are from that tablet or not, and whether to keep going or whether to whether to discuss with your doctor having a break and retrying something else. Another one that we've had this week is you have medication that is quite specialist and that's usually started by a specialist. So I am thinking sort of autoimmune immunosuppressants, and there's one that's called azathioprine, which is used for treating many different conditions like rheumatoid arthritis, psoriasis, Crohn's, sort of all the autoimmune conditions where your body's sort of immune system's attacking itself and attacking its skin or its joints or its intestines. And so you put on an immunosuppressant. And these are quite toxic medication that require monitoring, usually every 3 months, having blood tests. And we've had azathioprine. It's been on the market for decades in a 25 milligram and a 50 milligram strength. And people are prescribed sort of the dosage of that, maybe up to 150 milligrams. So they might have 50 milligrams, take 3 tablets, the 150 milligrams daily. Recently, another company has fetched on the market a 75 milligram tablet and a 100 milligram tablet. And it's been raised as a risk that some people are being swapped onto those higher strengths, and community pharmacies are stocking those higher strengths, and there's the risk of errors. And whereas we would hope that, you know, the GP prescribing, the pharmacist dispensing, and the double checking within a pharmacy that errors shouldn't happen, they can happen. So we've decided to put into place that we're not going to use these 2 new higher strengths. We're going to make sure people just stay on the lower strengths. So one of the things that I can do in my job role is do a search of across GP practices of where people have been prescribed different medication dosages. So I was able to do a system-wide search to look to see if there was any of the 75 milligram or 100 milligram tablets being issued and dispensed. So I did that search. I found out the practices where there was. I went into them practices and then actually asked to look at the patient records there, looked in, double checked that they were correct. And then I actually did phone up one gentleman and say, we're just trying to reduce errors. We want people to be making sure that they're only using the one strength so they know exactly what's happening. And he was great. He was great at making, saying, yeah, I do know what I'm doing. I am taking the right ones, but I am fine in having it streamlined so that the community pharmacy don't have those higher strengths. I'm fine at taking 3 of the lower strength to make sure that they don't have the higher strength and there is the less risk of the issues. So little things like that I quite enjoy doing. They looking at the higher level, looking across the patch, doing guidelines that sort of make things safe, you know, for the whole of the area that I'm looking in, making sure the national guidance is, but then getting back down and actually talking to an individual patient and making sure that it's right for that one individual. I just love that about my job, being able to do it from one extreme to the other. All right. I'll come back to you, Ray, but yeah, Demi, yeah. So don't worry about being late, but there are flukes. These are my 8-week-old kittens that we've just had. You missed it earlier. One of them did an escape out of my daughter's bedroom across the hallway, so I had to go and pick up Poppy and take her back. But this is Poppy and Periwinkle. They're 8 weeks old. Oh, I'm just looking. My other cat's just walking across the fence outside. Yeah, my other 2 cats are they're sort of accepted that there's kittens in one room, but we're trying to sort of just keep them separated and getting used to each other. There is a video right back at the start of the live stream if you actually wanted to see a quick picture of them. Oh, I've just realised why my cat's at the top of the fence. The woman who owns a load of yappy dogs has just walked past and barked at her. I don't know if you could hear the barking. Right, so I'll go back to you, Ray. Ray's question. My preferred nicotine cessation products for teenagers, especially with the rise in vaping. Well, my preferred is that we can discourage teenagers smoking and vaping in the first place. That would be the preferred option. But teenagers will be teenagers. Teenagers always want to have something that they can use to rebel, feel as though they're more adult and do. So I know that in the UK, they're trying to increase the age for cigarettes so that this next generation of teenagers will never actually get to an age where they're allowed to actually have smoking products. So they'll never be able to have smoking products legally. That's not to say, we all know that everybody smokes before the age they get smoking products. The same with vapes. The problem with vaping is, especially with teenagers, because teenagers can't buy legal vapes, they are buying the black market illegal vapes. And I know full well from my daughter, when she was at secondary school, the illegal vapes that were so easy for them to get hold of, they could all get hold of the black market vapes. And the black market vapes contain all the ingredients that can cause problems like popcorn lung. So when it comes to getting people off smoking products and the nicotine replacement, really it's engagement. So with them actually wanting to. So we're in our local area, in most of the local areas in the UK, to have access to smoking cessation products and nicotine replacement products, although you can buy them. So if somebody is motivated to go and buy them, if you want them on the NHS, you can only have access to them for free on the NHS if you are engaged with a programme of support to help you get off them, so that you actually have that support from a member of one of the agencies to help you actually with the willpower and the right frame of mind to actually get off. So when it comes to nicotine cessation, just going through either going through a plain vape of nicotine, so just the plain product without the different flavors and smells. All the nicotine gum is fine, all the patches is fine, as long as it's with that support to help you step down. Now there is the two medications that you can take that are supposed to suppress the reward center in the brain. Now we don't recommend either of those, although they are available on the NHS. We don't actually recommend them. I can't remember the names of them off the top of my head because we don't actually recommend them, so we don't actually have any prescribing of them. Because although they help reduce the sort of reward center of the brain and that sort of addiction center, they do run the risk of side effects, especially when you first start taking them, of suicidal intent. So we don't tend to recommend them at all. So I would just recommend just getting sort of support from one of the local services. In the UK, every area has some sort of smoking cessation support that you can get hold of. They do it by telephone, they do it by online, and they do it in person. So that's how I would. All right, so does that answer your question, Ray? I don't know, I've sort of gone round. So Make Me Smile says, do you think pharmacists in the UK learn more than the ones in the US? I can't answer that because I have no idea what the US training schedule is like. I am hoping sort of over the years since I qualified, there has been a lot more put into the degree and into the training afterwards. So here now we have 4 years of the degree, a year postgraduate sort of, it's called pre-registration training. So you have a year where you need to either be in the hospital or the community or a combination of both, and also in sort of in the integrated care board. We usually have the pre-regis for about a month of the year. They come to us and they get a whole rounded sort of experience. But even then, once they've done their registration after that year, then they are sort of the newly qualified pharmacists. They usually then do a 2-year postgraduate course where they're classed as sort of basic grade pharmacists, and then they go round again, a bit like junior doctors. They will then go around having sort of so many months in different areas. If they're in a hospital, it'll be around the hospital and into primary care. And then if they're in a community pharmacy, they'll also get to go into a GP surgery. And then after that couple of years, then they'll have more training. So yeah, there is a lot of training for the UK pharmacists. I don't know how that compares to the US ones. But yeah. So Coconut says they've increased the age to 21. I'm assuming that WA is Washington State. Yeah, you can buy flavorless and nicotine-free vape juices. Yeah. The problem is the thing that teenagers have got is the vapes. They come in so many different flavors, and I have to say I can't stand the flavoured ones. Now, my daughter is 17 and she does have some friends that do smoke some of these flavoured vapes, and the smell of them gives me migraines. So I have had to put up the thing of no vaping in my house because the flavoured vapes do trigger a migraine on me. But her mates are fine. I've said, you know, I have no problem if they do vape, they can vape outside. Obviously, I would encourage them for their health not to vape, but they are teenagers. The same with alcohol. I'd prefer them. Obviously, in the UK, alcohol's 18, but to drink publicly out in pub, to buy publicly, but you can drink at home before then. So my daughter, we do have the occasional drink because I prefer her to build up a tolerance, know her level, know how to tolerate it, and drink it sensibly in moderation. So we do. Right, so Rare says, well, Butrin and Chantrix, yeah. So the Champix in the UK, yeah, we do have them both. They are occasionally used and prescribed in the UK. They're not banned. They're not first line. There would really be somebody who has been through the service a few times. They've really tried with the support. They're really, really struggling. Then they'll go through an assessment that they haven't got any other mental health issues. They're warned of the potential side effects, and then they are given. So the prescribing of it is very, very low. It is sort of last line for somebody who's really determined to stop. They really want to. They've been through. They're just really struggling because, yeah, addictions are hard. Yeah. So they are prescribed. They are still prescribed worldwide. Hi, Tanya. Yeah, Coconut says, I vape. I was a stroker for over 15 years and used vaping to quit regular cigarettes. And that's great. So cigarettes, we definitely know the dangers. We definitely know the hundreds of chemicals in there cause significant problems. So going down from that to a vape where you've just got nicotine, as long as it's a legal vape that you know is of good quality, then going down from all of those chemicals and potentially carcinogenic issues down to just having nicotine in a couple is a lot safer, is a lot better for your overall health, is a great sort of risk reduction. And yeah, we've all got to have something in our life. We've still got to enjoy life. We can all do with the amount of risk reductions as possible. But yeah, we still need to enjoy life. Yeah. I still enjoy the occasional drink. I still enjoy my food. But within moderation and being sensible. Exactly. You're also an adult, and that is a thing. While children are children, we need to do our job as parents and as a society to protect them and not put them in harm's way. But yes, adults can make informed decisions, but there also does need to be that information out there. There's a lot of people out there that are not making informed choices because they have not been given the correct information. And that is one of the reasons behind this channel is I want to try and debunk a lot of that medical misinformation out there. There's so much medical misinformation out there that people can't make informed choices because they have been given the wrong information and the wrong information out there and getting. And the problem is the clickbait reels have the incorrect information out there because that's what people watch because, you know, it's clickbait. It's there. It's exciting. It's not the nuance of that may be okay, but it may not be. This does work for 80% of people, but then there's 10% of people that get a bad side effect. That sort of nuance and explaining of risk benefits doesn't get the clickbait and doesn't get spread across social media. Yes, please, everybody, link the stream. Tastes like clean kitties. Oh, yeah, they don't. They're just so cute, and yeah, I pick them up, and they are quite snuggly, but they are a bit too crazy. So when they're sort of dopey and sleepy, you can have a bit of a cuddle, but most of the time they're just wanting to bounce around. Yep, coffee's your vice. I don't like coffee, but I will have tea. I will have my Pepsi Max. I'm trying to ensure that my caffeine is in the morning Caffeine can be good for you as long as you don't overdo it. If you've got heart problems, coffee can be very good for you. A spoonful of coffee granules has 5 grams of 4 grams of fiber in it. So it's really good for your gut microbiome with the polyphenols in it. However, coffee, you can get all the benefits from taking it orally from your favorite brand. Do not do coffee enemas. If you want to know why not to do coffee enemas, I do have a video on that, but please don't. These people, again, with the spread of medical misinformation, the people that will say how amazing it is to detox, it's like, yes, if you're constipated, you do need to empty out your bowels, but for everybody else, you do not need to detox your bowels. Your bowels are naturally self-detoxing. Your liver is naturally self-detoxing. Your kidneys are naturally self-detoxing. Your vagina is naturally cleaning, self-cleaning. You do not need to do anything to clean and detox your digestive system or any orifice. You just don't need to. So that's it. That's me gone on my rant and my tangent. Tanya says, I'm so glad that in your teens are taught about knowing their tolerance level to not get sloshed all the time. Yes and no. Some teenagers are. Unfortunately, not all teenagers in Europe come from good homes. Sometimes sometimes parents have their own issues and problems, and they can be passed on to the next generation. There's also the opposite of the fact that they may come from really good homes, but their parents may hold such a high standard that the kids then want to go and rebel. And it's finding that balance. I hope I found that right balance for my daughter, as in I've not said no, I've allowed her to know it exists. I'm hopefully not put too much of my own issues and anxieties onto her. So hopefully my daughter has found a balance. But yeah, I think it's a problem in every country. You go from extremes. You have parents that have their own issues that get put on the kids, and then you have parents that are the opposite. So so Tanya says, here in the US, alcohol in teens is a real problem because they're not taught tolerance and about overconsumption. I also do think, and I am going to blame media and, sort of all the films and programs that are out there. All the American TV shows show all of the US teens drinking like it's totally normal and that's what you should do. I've just been watching, I don't know if anybody else has been watching on Netflix, Ginny and Georgia. I've been watching it with my daughter because it's great. It's opened up for us a lot of conversations where we can have that conversation of that wasn't a safe thing to do. Should they have really done that? But they do seem to be the shows out there and the Netflix dramas and things that really encourage a lot of teenage drinking and drugs and other things they shouldn't be doing. Demi says, it's so sad to me that people would rather get clicks than have integrity and provide correct information. Definitely. And that's one of the reasons why my channel isn't growing as quickly as I would like it, because I don't do anything for clickbait. And obviously I've attracted this nice group of you that come on my live streams, but I'm probably preaching to the converted as such, as you are people that are sensible yourselves. That's why you've joined my live stream. Getting that information out to more people is hard. Plus the fact I just don't have time at the moment because I've taken on extra hours at work and I've taken on I've stepped up into a line management position. So I have a whole load of new stuff that I'm learning at work. I've also I'm now on a training course for managers. So I had that this week as well. Yeah. Tanya says, I agree. Yeah. Coconut says, for the love that all that is holy, do not put coffee on your. Exactly. Yeah. So Make Me Smile says, I detox my bowels if I need by taking X-Lax. So yes, laxatives can be useful for people that have medical issues and constipation. And I've done a live stream on laxatives. I've also done a video which is called I Hate Lactulose, which explains to me why I don't like lactulose being used as a laxative, but the other laxatives that should be used for, say you have constipation because you're on an opioid for painkillers, what you should take, or if you have constipation for other things. Yeah. So Tanya says, oh, absolutely, but alcohol isn't as taboo as it is here in regards to kids drinking. Yeah. So detox to get rid of constipation. Yeah. And it isn't really a detox. It's you treat constipation. So you're treating the condition. You don't need to detox. Your body should detox. I'm well behind on these comments. So Tanya says, oh yeah, media is awful about alcohol consumption and peer pressure being what the cool kids are. Yeah, but it wouldn't make a decent film if the kids were all, oh yeah, this is sensible. We're just going to have the one drink and be sensible, and we're just going to, it wouldn't make a good thing. Or we're going to wait until we're sensible to have sex, and we're going to use all the precautions. It wouldn't make a good film or series, would it? Yeah, Coconut says TikTok is the worst for medical misinformation. Yeah, I avoid TikTok. So the only thing I find out about TikTok is by watching YouTube creators that comment on TikTok drama. I myself keep off TikTok. Ray says, my friends and I were at the pub regularly at 16 in England. Yeah, well, actually, I said I wasn't when I was 16. I was a bit of a nerd. I was into my college. I was into, my schoolwork and my college work. But I went to university at 18. First week at university, where there was the bar in the hall that I lived in, I went down. So there was a lad down there that did later on turn out to be my boyfriend. There was a lad down there that had a pint of cider, so I had about a quarter of a pint of his cider. I went, oh, that tastes nice. And he went, oh, I'll buy you a half. So he bought me half a cider. I downed the other half of the cider. I fell off the bar stool and he had to carry me up to my bedroom. He did eventually become my boyfriend, so that was nice. But by the time I left university, I could do the Campus 14, which required having a drink in each of the 14 bars on the campus. Got to the end bar and it was triples for £1.50. So I had a triple in the last bar. So I had 16 units, 16 shots. So yeah, I came out of uni very well trained with my alcohol tolerance, but been there, done that. And now I just have the occasional cider, maybe once a week. Yeah, so hopefully my daughter will be sensible. Yeah, right. Jessie Lee, that really upset me to see her downfall, see all the medical misinformation that she put out there. If only she'd actually listened to the doctors. The doctors were correct when they gave her the prognosis in the February, March that she wouldn't see out the year. She didn't. She spent so much money. They all talk about Big Pharma taking money. The cost of the chemo that she could have had would have been significantly less than the crazy amounts of money that she was doing on all the crazy supplements and pseudoscience that she was doing, having a PICC line put in to have ozone therapy and such, like, so dangerous, so expensive. If only she had listened. We can't say for definite what would have happened, but she would have had a much better chance. Yeah, Tanya says, I cannot believe as adults we have to tell other adults not to pour things up their butts. Definitely. Right. Yeah, Coconut, I myself have been in a comment war on TikTok over misinformation. Yeah, the amount of times that I get into comment wars, I try putting out sensible information. People just do not want to hear it. And that's my reason why I've given up doing shorts on YouTube. I have done some shorts on YouTube. I tried putting those shorts on Instagram. It just got crazy comments. The amount of people that go, are you even a qualified pharmacist? You don't know anything. You're just up for big pharma. And I usually just say thank you for the engagement. I will continue to do clinically evidenced information, and I just sort of sidestep it and move on. But yeah, I'm not starting comment wars with people in my thing. I just say thank you for the engagement and move on. Yeah, TikTok. Yeah. Cal says, Tanya, that made me laugh. It reminded me of our priest ending up in the ER with a potato up his butt because he was handling the curtains nude. Made it to the papers, and still told me it still breaks me as 20 plus years. Yeah, 20 years ago, I remember during my training. So as a pre-reg training, you always got the interesting job. So I remember being sent up to A&E to collect a package to put into the controlled drug cupboard ready for destruction. So basically, this person had been admitted to A&E with a package stuck up the rectum that contained a controlled drug, and they'd had to remove it, they'd had to seal it, and then we had to put it down in our controlled drug cupboard to keep it ready so that it could be checked by the police and then appropriately destroyed. It's like, oh, thanks for that. I also remember trigger warning of dead bodies and such like, but during our training, we got the potential to go to the mortuary at the hospital and to see their room of interestingness. I don't know what you want to call it, where they had jars of pickled things. And one of the ones was so you'd have your pickled heart, your pickled lungs. So there was the pickled lungs, which showed full of tar from cigarettes. There was also the intestines, where there was a big can of WD-40 had been stuck up the rectum of somebody, and obviously they died, but they'd left it in the room of interestingness. So definitely do not put anything up there that shouldn't be there. So Sam says, the amount of teens that my mum treated for getting extremely drunk and breaking a limb or two. She's a retired TI. Okay, I'm not quite sure what TI stands for. Is that something to do with sort of ambulance technician or something? But yeah, unfortunately, getting drunk puts you at so much risk of damaging things. And then with the alcohol in your system, when you do get to hospital, you've got to be really careful. You can't go under anaesthetic or anything until your alcohol levels are down to actually have any procedures done. So getting into a car accident when you're drunk, getting into injuries when you're drunk, and then being able to be looked after is difficult. Good. Chemo pimps, she yelled day in and day out. Yeah, there's nothing wrong with having chemo. There is also nothing wrong with saying that you don't want chemo and that you just want to go the palliative route and that you just don't want to put your body through that. Some people do decide, and that's perfectly fine as well. But to spread medical misinformation that pseudoscience thing can cure you is a different matter. But yes, everybody can make their decision of whether they want to go through the route of chemo or palliative or whatever. Hal says, the part of me wonders whether she was worried about her looks due to chemo, since it was a big part of the marketing. maybe, but even so, even people that sort of lose their hair, there's wigs and things. So Demi says everything is for profit and money is a human, especially if someone who's promising you a miracle treatment. Yeah. And I know the system in America is totally different to the UK, as in you've got to pay your insurance and then you still have to pay out of pocket and extra and additionals, and things can get very expensive medically wise. But going down the other supplement and pseudoscience side can be very expensive as well. They're all out to get money. At least big pharma are wanting the money back because of the research and the development, and they're not just wanting the money back to line their pockets. Oh, I'm well behind on these things. So Cal says, buddy of mine did ER nurse for a while and said people just about anything in there. Action figure up there. Yeah, action figure, that's quite a common tale. I've heard that one before. Live animals, dead animal. Yeah, I've heard of them as well. Okay. Yeah, so Demi's saying that personal experience of being prescribed something. It was financial reasons when I was a teenager. But I'd rather have proven medicines than pay 20k for celery juice and coffee enemas. Yeah. It is a matter of looking around at all the different options, and sometimes you may have to balance sort of. Well, in the NHS, we have to do it for patients. We have to balance the cost of the medication to how effective it is, and some of the new pharmaceuticals that are coming out are ridiculously expensive, especially these sort of new, very targeted, specialized biologics can be really expensive, and does that work out being cost effective to provide it on the NHS? Which for us, we make that decision nationally of, can we get the pharmaceutical company to knock the price down to make it cost effective for us to provide it on the NHS for our patients? But yeah, in other countries where it's the insurance that pays for it or people have to pay for it out of pocket, then that is a different conversation. Sam says, she was the boss of the physios and OTs at St. James's Hospital in Leeds. Yes. I have to say, I love the physios at Leeds. I went to St. James's in Leeds to get my official diagnosis of my Ehlers-Danlos syndrome or joint hypermobility syndrome when Professor Bird was, before he was retired, when he was the specialist up in Leeds. I managed to get a referral to the tertiary centre to see him to get my official diagnosis, and he then provided me with 12 sessions with the physios at Leeds, who are the specialists in joint hypermobility, and they were amazing. So yeah, love the physios up there in Leeds. Demi says, my grandmother opted for palliative care because she was also had a horrific short prognosis, and that was fine. She wasn't going around screaming about Kimpo pips. Yeah. So yeah, palliative care is an appropriate route for some people, and that is a choice as long as people are given all the information and they can make an informed choice. And if they are having difficulty with that, for the whole family to be given all the information and make an informed choice, as long as there's nobody there that's with bad intentions, everybody should be able to sort of make the informed choices around what they want to do. I do watch them. I think it's Nurse Hadley and another nurse, a hospice nurse on Instagram, and they are amazing, and they show sort of all the nuances about how to decide what is best. Okay, Cal says, my government decided gut care is a luxury, so my meds are expensive for my IBS, but all my other meds is a max like €2 to €5 every 3 months or so. Yeah, and that is a big problem of access to different medications. And I know sort of even in the UK, the NHS is not perfect. We don't have enough money in the NHS to make sure that all of the drugs that are out there have access for everybody. So whereas you may want to jump somebody up that's young and fit and up the queue to have treatment and have the newest things on the market, we have to go through the slow process of referral, waiting lists, through all the sort of cheaper, more cost-effective agents first before we go on to the newer, expensive agents. So we have that process for the NHS. In other countries, you might be able to jump to the newer agents first, but then it comes with the price tag that either is paid by the person or the insurance. So I'm just going to switch the light on. It's getting dark. So I wouldn't say any country's got it right. Every country's method has different pros and cons. Hi, Julie. Nice to see you. Right. Mr. Ranger Lab says, everyone I know has or had a job where they were paid for their work. Some can yell Kimpo pimps because they're paid for their work or services, but we are so the providers of unproven work. Yeah, which is exactly, that's what I said earlier. So yeah, you've got all these MLM reps that are saying, oh, chemo pimps are out there to make money. Well, actually, no. Drug reps are out there on a set wage, no matter what. They actually get paid. Whereas you've got these MLM people that are out there promoting, and they only actually get paid if they manage to recruit a team underneath them to promote it. They're not getting it. The company are making double the amount of money as such, because they're not having to pay for advertisement. They're not having to pay half their staff, and they're getting in a ridiculous amount of money for overpriced stuff that's never actually been tested, because they've never actually tested for effectiveness. They might say that they've got third-party testing or in-house testing, but basically they go, oh yes, we've made a product that contains a drug, that contains an ingredient. Oh yes, we've tested it. Yes, it contains that ingredient. It's like, that's not rocket science. That's not that's not what's required. You need to actually prove that what you've made actually gets into somebody's body and actually has the action that you want in that person's body. Coconut says, I've been to 7 specialists for an EDS diagnosis. Every single one has referred me to another specialist, and the last one flat out denied to schedule an appointment. I'm looking into private practice. Oh, that's so frustrating for you, Coconut. Luckily, I was very lucky. But half of that is because I'd already done my own research. So what I'd had was, when I was 21 and I'd had problems with my hips and my knees and everything at university, I went and saw a surgeon about potentially having operations on my knees or hips. And they said, oh, yes, you tick 10 out of 10 on the hypermobility spectrum. You're definitely hypermobile. There's no point me doing an operation, because it'll just revert. And I sort of got discharged and told to live with it. I then saw a rheumatologist a few years later when I was struggling and everything, who basically turned around and said I was depressed and I just needed some antidepressants. It was all anxiety, even though the fact was that the anxiety and the depression was the fact that I was in so much chronic pain and really struggling. So, well, yes, it can be a vicious circle downwards, but yeah, that just made things even worse. I carried on struggling, and it wasn't until I sort of done my own research on Ehlers-Danlos syndrome, on joint hypermobility, I put everything together. I wrote 2 pages of all my symptoms, all my family history, all of my information, went to see my doctor, went to see my GP, and said, I want a referral to the specialist because the one at the local hospital was useless. And he agreed to send me up to see Professor Bird. I went up there. I took my friend along. We took all my notes of my whole sort of history, and he gave me the diagnosis and put me in with the physios. So since then, I've not really needed to do it. I've been able to do it myself. But yeah, that's only because I knew exactly what to do to get me a referral to that specialist to get that. And luckily since then, because of my diagnosis, then obviously the genetic component, people within my family that have got the same genetics. Although it was quite thing, my granny, she was in her 80s, went to hospital and actually came across a consultant that was actually, oh yeah, Ehlers-Danlos syndrome, yeah, definitely got it. It's like, okay. So, Make Me Smile says, I quoted Mark Twain, but I guess Nightbot didn't like it. Oh, Nightbot can be a bit of a pain. Sorry about Nightbot. I've got it on there to try and help me, but to stop rid of silly people, but has been known to block people with putting too many emojis. Julie says, hi, Cal. My husband has untreated ulcerative colitis. Treatment is too expensive. Such a shame. There is such amazing, the new biologicals for ulcerative colitis, but yeah, they are coming in at, they cost like two grand a month on the NHS. So luckily on the NHS is paying that 2 grand a month and it's never passed to patients. But yeah, in other countries, that's quite often passed to the patient. But yeah, but in the UK, you have to hit certain thresholds. You have to be bad enough and have gone through the waiting list long enough to actually get access to it. So I'm not saying that the NHS is good or bad, but just different. Cal says, thought it might be that, but turned stomach ulcers and super severe IBS. Yeah. Cal says, which MLM was it again where their wonder supplement didn't dissolve and people were pooping it out? Make sure you get absorbed. Oh, wasn't Elamir because they were the strips. Yeah, it wasn't Amare because the Amare are the drinks. I want to say, was it like Awakened? I think it might have been Awakened. But yeah, so they obviously were lying the whole time about its effect. It obviously was a placebo effect if they realized that there was no absorption. But that is a problem with not just MLM supplements, with supplements from just companies that are not reputable. So like in the UK, I usually say pick a company that you know does proper testing on them. So if you get something that's like the Superdrug supplements, Superdrug or Boots or, you know, one of the main pharmacy chains, their supplements and vitamins will have been tested to check that they are actually bioavailable. But yeah, so some companies out there. I know when I looked up about melatonin, some of the melatonin that's sold in the US, some of it doesn't even contain melatonin or only contains like 17% of the dosage stated. Some can contain like 200, 300% of the dosage that's stated. And others even contain serotonin instead of melatonin. So yeah, it's not just MLM companies. It can be many. Oh, hi, Hershey boy. Oh yeah, Hershey says, yeah, I think it was Awakened. Yeah. Well, a weight loss thing. Yeah, they all claim that their medication causes weight loss. They're usually just something that's got caffeine in them that, you know, helps you be more active and suppress your appetites. They're usually appetite suppressants or something that sort of gives you more energy and keeps you a bit more active, which is just your overall calorie deficit of calories in over calories out. If you're doing more, you're burning more. And if you've got your appetite suppressant, so yeah. Hershey Boy says, I take a lot of meds, can't think of any that I could get rid of. Yeah, it's always every year when every year you should have if you're on medication, you should have a full medication review with your healthcare provider where you go through every single one of your medications, double check, what am I taking it for? Does that condition still exist? Do I still need to take the medication for that condition? Can I trial off it to see whether the condition's resolved and I still need it? And go through that for each medication. Go through each medication, going, is this medication to help with the side effect for another medication? So quite often what happens with proton pump inhibitors are quite often started when somebody has an NSAID for pain release or inflammation. They start them both at the same time. They stop taking the pain relief, the NSAID for the pain relief, and the PPI gets left on for years when they don't need it anymore because the original medication that they were using it to treat the side effects or doesn't exist anymore. So every year we recommend that everybody has a full medication review. In the UK, this is now starting to be done more by pharmacists than the GP or the nurses. The GP and the nurses do the reviews of the long-term conditions, but the pharmacists do the reviews of the medication. Going through, yeah, check, do you still need it? Is the condition you're using it for still there? Is it causing any side effects? Is there now a better alternative if you are getting side effects or it's not effective? Yeah, okay, you're unawakened. Hershey Boy says, there was a shortage again, the diabetes medication. I recently got a 3-month supply of Trulicity. Yes, so all of the GLP-1 injections, they're all in and out of stock. The newest one, the Menongrio or teriparatide, which is a GLP-1 and GPP combination, has got sufficient supplies at the moment, so people are being moved on to starting on that newer agent. As my daughter's saying, can we finish the live stream? So there is currently supplies of that. People are moving on to that because they can't get supplies of the other GLP ones. So we'll probably end up with that going into short supply. We just have to hope that eventually the pharmaceutical companies can keep up with the demand. But while there's such a demand out there on the private market for people wanting it for weight loss rather than for diabetes, we're going to really struggle. Oh, yes. So Awakened has rebranded as the Soul People. Yeah, that's just crazy. Every time I've tried to watch one of the live streams about the Soul People or videos about the Soul People, I've lost the will to watch it and given up. So sorry to all my favorite creators out there, but yeah, I manage about sort of 5-10 minutes and then I have to switch off because I just can't. Hirsch Boy says, I'm having a 30-year career in clinical microbiology. I used a lot of my skills. Excellent. Yeah. You've probably got a lot that you can talk about after having 30 years in microbiology. I have to say, I sort of can remember most of my different microbes, but make me smile. Right, so Make Me Smile says, a friend of mine has to take insulin. I believe her insulin is supposed to stay cold. Right, so the majority of insulin does need to be kept in a fridge between 2 and 4 degrees. So for the majority of insulin, pens, vials, they should all be kept refrigerated. However, the majority of them, once put to room temperature, are usually okay for 28 days at room temperature. So when you get insulin vials and pens, you should keep them in the fridge and they should be stored at the fridge for most of the time. However, once you actually start using a pen, you can carry it around with you as long as at normal room temperature, for about 28 days, which most people, a pen is going to be used up in less than the 28 days. If you can keep it in the fridge, the better, because you are going to keep the longer lifespan for it. But yeah, usually they get 28 days. So it's really always worth, with insulin, reading the packet to see what the expiry date is, and then if there is, whether it needs to be stored in fridge, and then if there is any instructions of, once out of the strict fridge at room temperature, how long it can stay at room temperature for. And usually it can be 28 days. But it is different. Not all of them are exactly the same. Some have to stay in the fridge the whole time, and some are actually okay at room temperature, but not very many of them. Yeah, so Ray, yeah, melatonin is a herbal supplement in the US. So yeah, so in the US it's available over the counter, and it depends on which company makes it, on what their what sort of restrictions, well, what sort of monitoring and testing they actually do to check whether it's in range. In the UK, it's a licensed prescription only medicine. So all the medicines in the UK available on prescription are licensed and obviously vetted, so they will be within sort of 99% correct on the sort of dosage. You know, there will be up to pharmaceutical grade. Unfortunately, they're a lot more expensive than what the products in the UK, because we have to have the pharmaceutical grade on prescription, and they're only available on prescription to certain people. So in the UK, for children, for melatonin, it has to be done via a specialist first, and then the specialist does it, and then it can be, the GP can continue it under shared care. Or there is a product for people over 55 years in the UK for short-term use for insomnia, but not many people, GPs, prescribe it unless absolutely necessary. So, although if you are in the UK, you can order from US sites to get imported into the UK, as long as it's for personal use. If you were to import it in from a US site into the UK and then supply to somebody else, that would be illegal, because obviously only a pharmacist or can supply, or a GP can prescribe. So when it comes to children in the UK, if you were to buy online and then supply it to your child, then it's a bit of a dodgy area on whether that would cover. I do know some consultants have agreed for a patient to, if they want to use the gummies that aren't available on prescription, they have said, if you are giving your child the gummies, be aware that they may not be correct. But yeah, it is. Yeah, considered as food and not monitored by the FDA. Yeah, exactly. Make Me Smile says, Hurricane Beryl knocked out her power and messed up her meds. Oh no. Oh, that is a real shame. So yeah, so things being in the fridge. So it's this, one of the common things we have. If GP practices lose power and their fridges go out, and they've got all the vaccines and such like that they've got stored in their fridges, same with hospitals and all their medications, it's then going through and then working out what the expiry date is post it going to room temperature. So some vaccines, we phone up the manufacturers and go, right, these vaccines did have this date being stored in the fridge. They've now got to room temperature. How long do we have until they have to be used? Do they need to be disposed of? Do we have 28 days? Do we have 2 weeks? And we'd put a new date on. We had that, can't remember when it was. I want to say 2010. But we had some major floodings, and we lost electric to a whole load of our GP practices, and we had to do that for all the vaccines. So, but yeah, so if your friend can actually make sure she reads the actual information leaflets, some of the medications may be okay for so many days at room temperature. But I have had my daughter text me going, can we finish? I want to eat before the football match. So I'm going to just have a quick look through and think. Sam says, I've still got a chest infection. Oh, this fourth week. Oh. Unfortunately, with chest infections, even once you've got rid of the bacteria that's causing the chest infections, it can take up to 6 to 8 weeks for the cough to go. So if you are still coughing up, coughing, and it's after you finished your antibiotics, it may be worth actually double checking and getting it tested to actually find out whether you've actually got rid of the bacteria or not, or whether you've just been left with the cough and trying to clear the inflammation that's there. So make sure you go back and have that discussion, because you may have got rid of the bacteria with the antibiotics, you've just still got the inflammation there. Hirschbauer says, my career spanned the rise of MRSA. Oh, yeah, MRSA, C. difficile, superbugs. Crazy. Anyway, I'm going to have to go because I've managed to talk without even having anything planned. I've managed to talk for an hour and 3/4. So thank you so much for you all coming on, giving me the discussion, asking your opinions on things, having such a good time in the chat. It's great to see you all here. You're all such a nice group of people. Obviously, I am preaching to the converted of sensible people here, hoping that I can get more of my information out to the people that need to have a bit more nuanced, sensible, pragmatic approach to medication and clinical evidence. So, yeah, so Mr. Rangelab being semi-involved with expiry dating for vaccines, figuring out a design of studies to incorporate unusual events can be and shall be challenging. Yeah, it's like, yeah, there was 3 months left on the expiry date, and suddenly we've gone to room temperature. What can we do? But yeah, do we suddenly have to say, right, everybody come in if you want this vaccine while we use them all up? Yeah. Or do we just throw them, which is the thing? Right. Yeah. Thank you. Great to have you all on here. Hershey Boy, Demi, Make Me Smile, Carl, Mr. Angel Lab, Sam, Lisa, everybody else. Great to have you all on here. It's been really good. I hope you've enjoyed seeing the picture of the kittens. I'm going to go watch the football, play with kittens, and have some food. So thank you. Bye.